Hi, welcome to the Out of Network podcast. I'm Dr. Ryon Parker in the studio in Las Vegas. Dr. Seth is in Tampa. Today, I wanted to introduce you to my dear friend, Laura Cadieux, whose story is one of resilience, transformation, and the power to overcome obstacles. Laura is more than just a wife and a mother. She's a true inspiration to so many. From surviving a long and difficult hospitalization with COVID to completely shifting her mindset, reclaiming her health, and yes, becoming an athlete, accomplishing many marathons, and having the opportunity to train live on camera at the official New York Peloton studio. Her story is one of healing, strength, and purpose. Laura, I love you. Thank you for being here.
Thank you for having me, Dr. Ryan.
I wanted to start with a message and a memory.
Okay.
This is a quote that you had written not long ago. 5 years ago, this week, the world changed as a global pandemic was declared. Just days later, I found myself in the hospital fighting for my life. I remember holding June, giving her what I thought might be my last hug and kiss. She had just turned 3. I remember the loneliness, the tears, and the desperate fight to stay alive. In those dark moments, I made a promise to myself. If I made it out, I would take better care of my body, my health, and my spirit. I even dared to dream that one day I would run a marathon. So I wanted to interview you, not only as a friend, but as a dear patient. And I wanted to talk about your experience during that COVID hospitalization. And if you could kind of take me back and talk about really what really stands out in that moment.
Okay. I'll never remember the night. I remember June's birthday had just happened and then the world shut down and we were in California and I told Josh, my husband, I said, we need to get back home because I don't know if we're going to make it back home. He said, okay. Later that week, every single day, I had a new symptom. And I said, oh gosh, I think maybe I do have COVID. I do not. And I remember 1 week later after being sick, I remember saying to myself, if I don't go to the hospital tonight, I'm going to die. I could just feel it in my body.
Symptoms?
I had shortness of breath. I had no taste to any kind of food, nausea, diarrhea. I mean, everything that they listed, I had.
And this was before it even had a name, correct?
Right. And so I went into full mom mode and I called our nanny, Lupita, first to make sure she can take June because we didn't have any family in town. She said, yes, I'll be there in a few minutes. I said, okay. Josh was finishing up taking June a bath and I got her pajamas and I said, don't get scared. I said, but I need you to take me to the hospital tonight because I think if I don't go, I'm going to die. And he got a little scared. And so we got June ready, got her a bag. And I remember Lupita was there in a matter of moments. And I just gave June that big hug and kiss because I wasn't sure if I was going to see her again. So Lupita took June and Josh took me to the hospital and they wouldn't let him inside the doors. So he had to drop me off. So he gave me a phone charger, my wallet, and my phone. And he said, I'll check in with you in a little bit. So I said, okay. And so I remember the waiting room had 2 sections and it was if you thought you had COVID and if you were here for something else. And I'll never forget, they didn't take me back to a waiting room. They another room, they had a nurse, they called my name and a nurse came out and she took my vitals. And I remember I was so weak that I couldn't even hold my body up that she yelled at me and said, oh, sweetie, sit up. Everybody thinks they have COVID. And so that was my first experience there with the nurse. And
do you remember what your vital signs were?
I don't remember. I just remember that my heart was in such distress that they took me to the back right away. And she threw me a mask to wear. So I said, okay. And I remember going to the back in the ER. And I remember the doctor yelling at me too because I had put my mask on incorrectly. I think the blue was supposed to be on the outside. I had it backwards and he yelled at me. They took an x-ray to see what was going on with my chest. And I remember my vitals were so bad that they admitted me right away, but they refused to give me a test because they had very limited tests at that time. And so they admitted me. And I remember, I think it was maybe my second day in the hospital. My vitals and everything was so bad that they said, okay, we'll give you a test, but it'll take about 3 days to come back. And I just remember being so weak in that hospital room by myself that the bathroom was maybe about 5 feet away, and just getting up to use the restroom was impossible.
And you were alone.
And I was
Josh
alone.
Josh could not come back.
Josh could not. And I remember asking, can I sign for something so that you guys can give my husband updates? And they said, oh, you don't need to do that. But they wouldn't give him any information. And he would call to talk to me, and I could barely tell him how I felt, what was going on, because I could barely breathe. And they had me on oxygen and all different meds because they were just trying to figure out on how to heal me. And I remember I had bilateral pneumonia as well. And I just remember being very alone in that room and just watching the news and watching everybody that was going to the hospital die. And I remember when they finally got the test results back, I remember them saying that I was case number 26 in Nevada with COVID. But I remember feeling really alone in that room because the only people who would come in would be the infectious disease doctor and the nurses who held my hand and cried with me.
Tell me what they were wearing when they walked in.
Oh, it was like, and I could see them before they came into the room. They had to wear these hazmat suits. Mm-hmm. It was pretty insane. And then I had to talk to them through a big hazmat suit too, and that was very, very
Did you feel
hard.
like the Scarlet Letter.
Oh yes,
right?
yeah. And my the doctor who was in charge of me, he wasn't allowed to come to the room, so it was almost like a pod in the middle of the room with a glass window, and he would talk to me through there, but he never came into the room.
No one actually laid a stethoscope on you?
No.
Or listened to your breathing, palpated your stomach?
None of that. I just had the nurses who came in and it was very quick. It was maybe less than 10 minutes every time that they would come in to take my vitals. And, but that was about it. And I was in there by myself most of the time, felt very alone, very scared.
There's a picture of you standing, I don't know if it was the second floor or first floor, but there's a picture of you standing, looking out. Mm-hmm. Was that in that room?
It was in that room. Yeah, I remember because Josh brought me something that my cousin worked at the hospital, so she was able to get me whatever he brought. I think it was pants or something like that, so I can get changed because I was in the same clothes I was in. And I remember I said, I'm in the room actually where I had June. It was the same exact room when I had given birth to her 3 years. Yeah.
Really?
Yeah. And so he knew exactly where I was at, and I was able to see him down outside.
Oh my gosh!
But that was the only closeness that I had to anybody. Yeah.
Why do you think you were affected so badly? Do you really think it was at the time kind of your current health situation, or do you? I don't want you to necessarily disclose your medical history, but was there something that you think was going on at the time that made you be affected so terribly?
I think for me, it could have been because of my weight. I was very weak. I didn't take care of myself. I was about 70 pounds heavier at that time. Always thinking about June and Josh and putting their needs first and always putting my needs second. Yeah. So I never took care of myself. And I think that might have led up to.
Sure.
Yeah.
We now know that COVID primarily affected those people who have metabolic disease or metabolic syndrome. So those patients who were either pre-diabetic, overweight, the typical metabolic conundrum of hyperlipidemia, high cholesterol, elevated blood sugar. So, that we know is a given. So,
yeah.
Can you tell me what your recovery was like? So you were hospitalized for how many days?
I think I was in there for about 7 days.
Okay.
And as soon as I remember they gave me something because I think it was on the 5th day, I remember Josh calling me and telling me, you've got to fight this. You've got to fight this because you've got about 5 hours left or they're going to intubate you. And I was watching everybody on the news, whoever got intubated was not making it out alive. And some medicine, I can't remember the name of it, they gave me. And I remember I had to go to the restroom and I got up and I was able to get up and walk to that bathroom.
So every breath was a struggle. When we talk about intubation, that is securing an artificial airway because the body cannot breathe on its own.
Right.
So every breath, was it a challenge?
It was
literally?
a challenge. And that one time, whatever medicine they gave me worked because I was able to get up to go to the bathroom and come back feeling okay, a little better. And I remember calling Josh and be able to have almost a full conversation with him. And he was so happy to hear.
Wow.
Because I was hours away. And I remember my dad calling me too. And everybody was just praying that I was going to be intubated.
What went through your mind when he said, you've got to fight?
June.
Yeah.
She had just turned 3 and I just didn't want to lose her.
Yeah. Amazing. You know, you realize in these moments that all of us face that we're almost at a crossroads.
Right.
Where we can either choose to go down one path or venture to another.
Yeah.
And maybe this was a gift for you, Laura,
I think so.
at the end of the day.
Yeah. I just remember saying that if I made it out of here, I promised to myself that I would take care of myself.
How was your recovery at home and the emotions involved with that? And
Yeah. So right after I got home, it was a very slow recovery. But I remember everybody was ordering a Peloton bike, and I saw commercials for it, and it was very expensive at the time. I think it was like $2,800, and I remember saying, "Oh, you know what? I'll buy it for Josh for Father's Day," as an excuse.
you think he was a little overweight at the time
yeah, and
too?
he was too. And I said, and so I bought it for him, but it was more for me. And I remember because there was such a wait on getting it. I think we didn't receive it until July 3rd. And I ordered it after I got out of the hospital, so maybe early April. And I remember getting on that bike.
For the first time.
For the first time. And it was so hard. And I said, what did I do? I just spent all this money on this bike. I could barely pedal. I could barely get myself on the bike. Josh was helping me get on the bike at that time. And it was a really, really slow time. I didn't know if I could do it.
We're always motivated by something.
Mm-hmm.
Was it truly being in the hospital, having COVID, that motivated you for change?
It did. It motivated me for change. And I remember after that first ride, it was very, very hard. And I remember the next day, it was 4th of July, and Josh says, "Oh, I found the perfect instructor for you. Her name is Robin. You're going to love her. She's Latina. She's right up your alley." And I remember getting on that bike and riding with her, and I just felt so powerful.
How has your experience going through that shaped how you view doctors, the healthcare system in general, the nurses certainly? How has that shaped you? And you can, by all means, be honest.
Yeah, I just felt like there was a big disconnect. I felt that in the ER, I felt like everybody was really mean. No one wanted to help me. They didn't care if I was going to live or not. And it wasn't until I got to the 3rd floor that those nurses took care of me, and they were really good. And I'll never forget when I was in the hospital the second day, the billing department called me, and they wanted a payment of $5,600 for my COVID stay. And I couldn't even talk to them because I was so out of breath. And I said, I don't have any credit cards on me. I can't pay you.
So you were in the hospital fighting for your life, and this for-profit hospital actually called you
to
requesting.
get a payment.
Wow.
Yeah.
I have no words.
Yeah. I couldn't believe that. And I gave them Josh's number. They didn't call Josh, or maybe he didn't answer, but yeah.
Wow.
I'll never forget that.
Wow. Overall, how was your experience with the doctors?
The infectious disease doctor, he was great. And I saw him for 6 months afterwards. But I think that my health got better when I came over to Parker Medical.
Amen.
Yeah.
We'll talk about that.
Yes. Yes.
Do you, I guess, focusing a little bit more on the patient experience. So what were some of the biggest frustrations or fears that you faced? We don't necessarily have to focus on the COVID, but just in general, being a patient in the American healthcare system. What are, obviously, getting that phone call would be almost a slap in the face for me,
Right.
but have you experienced these same fears and frustrations outside of being in the hospital? Like, what is your
Oh, yeah. I
experience?
remember when I first came to Las Vegas, and I went to a doctor. I waited 2 hours in the waiting room, and the nurse finally took me to the back, went to the back, met with the doctor, maybe 5 minutes, and she didn't answer any of my questions. She said, "Oh, you're good," and I walked out. That was my experience. It was a
Wow.
very,
Were you ever sick prior to this or had a lot of exposure to the healthcare system?
I did not.
Were there other moments, so outside of fears and frustrations, was there anything, and we can go back to the hospital, that someone really showed more compassion or compare, something that stood out to you?
I really felt that the nurses were there for me during the hospital stay. I feel like they asked me lots of personal questions, and they asked me about June, they asked me about Josh, and they held my hand and cried with me. And I felt like that was really helpful. I also felt that even though I wasn't a full patient of yours yet, you were there to guide and help Josh too.
Blessing.
Yeah.
I often talk on this podcast how important relationships are with patients. And, I am very much criticized for charging patients a membership fee to be in the practice. And unfortunately, the system it sets us up for failure in many
Right.
ways with reimbursement. And it's almost like their push is for speed and profit over presence and purpose. And I want to be a doctor that is not rushed. I want to spend time and honestly have a lot of ownership for my patients' care. So it has been an honor taking care of you, my friend.
Thank
and I'm
you.
sorry that, in a way, I wish I was there a little bit more for you had I known. I know Dr. Miller was taking care of you at the
Yeah.
time as well, but that's horrendous.
Before meeting you, everything felt transactional. Everything was just based on money. And I remember when I sat down with you the first time, I remember it was about we had a 2-hour conversation, went through all my health history, and you sat and you listened to me. And that just meant the world to me. And I will
that.
forever be grateful for
love
you.
that.
Yeah.
What do you think is, from a patient's perspective, what is wrong with this system? What's broken about it?
Gosh, with concierge medicine, you guys are there. You guys respond to email. You guys work as a team. And I've also noticed my brother, who just passed away last year, he had Medicaid insurance. And I could just see how mistreated he was.
You care to share a little bit about that?
Oh, yeah. He was sent home with an infected foot and told him that it was okay. And a week later, he had his toe amputated. And then 2 days later, he passed away from sepsis. And I felt that he was not treated.
Do you think they just gave up ultimately?
They did.
The system failed him?
The system did fail him.
Do you think it was because of money?
Definitely. Yep. I tell my dad all the time, I said, if you guys lived in Las Vegas and he was under Dr. Ryon's care, he would have lived a full life. Wow. Yeah.
Wow. How old was he?
He had just turned 40 the week before he passed. Yeah. He was
Tragic.
pretty young.
How has being a wife and a mother influenced the way you advocate for your own health?
I feel that as moms, as wives, we always put everybody else's needs first. And I feel that if you don't take care of yourself, you can't take care of others. So I just feel that making sure that I'm taken care of as well so that I can be there for June and Josh.
I often tell patients, I'm also obviously a pediatrician as well as an internist, and I often tell patients that little eyes are always watching.
I agree.
And you are molding them how they will be for the rest of their lives. So how you choose to eat, how you choose to be active is really setting the stage for a future adult.
I agree. And I love how much June tells me how strong I am. And she tells her friends, my mom could run longer than you, run faster than you. And I love how she looks
You
up
probably
to me.
can, Laura. You probably can. Let's face it. So really, what got you into running and obviously competing in marathons now?
Yeah, so I had the Peloton bike up to 2023, and I've always seen people run, and I said, oh, I'd love to do that, but I'm so overweight. And then when I got into okay shape, I would say after riding the bike for 3 years, I had told Josh, I really, really want to run, and I'll never forget, he was on a layover because he's an airline pilot, and he was at the Great Mall of America, and he called me, and he said, I need you to check your email. He said, I want to happy Mother's Day. And he was at the Great Mall of America. They had a Peloton store. He had to go check it out to make sure it was good. And so he bought me a Peloton, a treadmill. I ran, and I had good endurance because of the bike. And a year later, I said, you know what? I want to run my dream is to run the New York City Marathon before I turn 45.
You have to qualify, right?
Yeah. Well, you have to qualify. You can get in through a charity as well. And I said, you know what? I said, what if I don't make it to 45? Let's run a half marathon. And so last year I ran my first half marathon, and I was able to convince some great friends to run with me. Yeah, and we did it together.
How hard has it been to develop the endurance? To go from, as you said, being 75 pounds heavier.
Right.
Probably not the healthiest, whether it's genetics or lifestyle. How has that, how have you developed your endurance?
Yeah, very slow. And I just take it, I listen to a lot of influencers that have a positive message out there. And I just take it really slow, and I just do my own workout.
Do you ever worry that it could also be almost the opposite effect, almost consuming you negatively? Like if I don't get home and get on the bike, that this is going to ruin my day, almost changing a little neuroses, if you will? Do you feel like that has...
I do, and I feel now that if I don't get my workout in, I do get a little crazy.
Everybody's hiding.
Yeah, everybody's hiding, and Josh says, have you not run today? You need to go run first.
You would still go, I remember you would go home around your lunch hour, right?
Yes.
Not to eat, but just to work out.
To get my workout in, yeah, because I knew that if I got that workout in, I felt so much better.
How often do you run?
I run about 4 to 5 times a week,
Wow. And how many marathons have you actually done?
I've done one. I did the Napa Marathon this year. Last year I did a virtual New York City Marathon. And then next week I'll be doing another Las Vegas Marathon.
I love it. Together with me?
Yeah, with you.
How has your relationship with your body changed? So I don't want to put words in your mouth, but being self-conscious, concerned about your weights, do you feel like your esteem has improved? Are you in a better state of maybe loving yourself a little bit more? I mean, has that changed for the better?
It has, because before my weight loss, I did what my mom did and not take pictures with June. So there's not many pictures of me and June when she was little. There's a lot of pictures of Josh and June. But I always avoided the camera because I was so depressed on the way I looked. So I avoided the camera back then. Wow. But now I'm always like, here, Josh, take a picture of us. Yeah. Take a picture. And because I am proud of myself.
Yeah, you should be.
Thank you.
Yeah, I would not, for everything that you've accomplished. I mean, going from that to what many people can't say that they've run marathons, Laura. So that's incredible.
Thank you.
Do you feel you are limited in any way based on having COVID and the pneumonia? Do you feel now that there are limitations that you have to work through, either medically or?
I think just my heart that sometimes is irregular, but other than that, I think I don't limit myself. I just keep pushing myself.
Good.
Yeah.
Good. Do you feel having the mindset has helped with your recovery and moving forward with obviously your wellness journey?
I feel like mindset is everything. I feel that I have that discipline in me, that I made that choice when I was in the hospital, that if I get out of here, I'm going to make myself a priority. So when times get hard, I just go back to that day. Even when I run, I'm I'm in 4 to 5 miles, I'm constantly fighting with myself. You're too old. You're going to get hurt. What are you doing? You should be at home getting ready for dinner. You should, all these things. I'm constantly fighting. And it's not until I hit that mile 6 or 7 when I feel free.
They talk about that on Peloton, that sometimes the hardest muscle to overcome is the muscle of the brain, right? Because I think the same thing.
Yeah.
And that is one you have to constantly fight to keep moving forward.
Yeah, there's a saying, and it says, your legs will carry you, but it's the mind you need to fight.
Right.
Yeah.
What is that the quote that you have in your house also?
No challenge, no change.
That's right. Okay.
Yeah. Which I agree. I look at that thing every time I get on the treadmill. Yep.
And why is Robin with Peloton such an inspiration to you?
I think first of all, I feel that I connect with her culturally. And then I think she just says all the right things. I love that she says, I will never feel sorry for you, but I will always train alongside of you.
Wow.
And I love that.
And you met her.
I did.
Right?
I did. So on my 5th year anniversary with Peloton, a friend of mine invited me up to New York, and I got to celebrate my 2600th ride with her.
Wow. Is that competitive to get into?
No.
Okay.
You just have to be available on Thursdays at 9 to sign up for the classes.
So you met her, talked to her, took pictures
Met her,
with her.
talked to her, told her, thank you for saving my life. Yeah.
Wow.
Yeah.
Wow. Amazing. If you could tell every physician in America one thing from a patient's perspective, what do you think it would be?
Find a way to reach your patients. I feel that that's important. Listen to them. Listen to what their needs are. Don't make the appointment transactional. They're human too.
Yeah. Do you think that outside of just the relationship, is there anything else that we need to do better?
I think just be there for the patient. I think that's so important. I think that everybody is such in a rush to get things done, to go to the next appointment, that just being there for the patient, letting them know that they are there.
Can you share your experience? And this is not a pitch for Parker Medical, but can you share your experience on obviously being in a non-concierge setting as opposed to a concierge setting like mine?
Yeah.
What from the minute you walk in to?
From the minute you walk in, you're greeted by name, and it feels like you're at home. It feels family-like. Everybody's working together. The nurses take you to the back and they ask you about something that might have happened the last visit, or maybe something that just happened with life that they remember. And I feel like Parker Medical, the concierge medicine, is great because I feel like they work as a team, and I think that's so needed.
So you can definitely tell a difference in a concierge setting as opposed to being in a traditional office of just
where they're just pumping out patients and there's no real care. Yeah.
What would you tell another patient, maybe to the Laura 5, 6, 7 years ago now, who was like you? What would you, who may not have had a hospital or a condition such as yourself, what would you tell that person who is like you on either changing their mindset or being able to take charge of their own health?
I feel that self-pity is a disease, and if you don't take care of yourself, you can't take care of everyone else.
Yeah. Do you think a lot of us are victims, like subscribe to that victim mentality?
I agree, because I was one.
Yeah. So how do you break it? Is it just a sentinel event such as being sick, or what?
I think everybody needs to have that drive in them that changes them. And I feel like if it doesn't, I know that some people get told, oh, you need to lose weight, this and that. But if they don't have it in them, if they're not ready, or they don't have a scare or an event, it might not reach them.
Sure.
Yeah.
It's interesting when you look in the literature, what is the best thing that motivates people or patients? For me, I always thought it was fear, right?
Right.
Either the fear of dying or the fear of whatever, and it's not. We are not humans are not motivated by fear.
Right.
I think at the end of the day, there's something in your mind that has to snap to click for change, and you ultimately are going to want to change.
Yes.
And I think that's why I say you're an inspiration, Laura, because ultimately, I don't think it was necessarily COVID. It may have lit the flame,
Right.
but I think there was something that you saw deeper in yourself, and yes, maybe June and your family, to make you move forward. So it's truly inspirational.
Thank you.
How do you define your health now, after everything you've experienced?
Yeah. I look at myself as a strong mama. I love how June looks at me, and I want to continue to be that role model for her. And I keep her active too. So she does gymnastics twice a week and baseball twice a week too. And she sees that. She sees me, and I think she wants to be strong too. And we're always in the mirror looking at each other, our muscles. So
do you see how she is being molded now?
She is.
For what she is going to do in the future. So kudos to you. Because had that not happened, who's to say she would have been following in maybe that same trajectory that you were, right?
I agree. Yeah. And she tells me, she said, one day I'm going to run a marathon with you. So I hope I'm not too old to do that with her, but I would love
She'll
to.
push you in the wheelchair,
yeah,
Laura.
Exactly.
Do you think you've inspired your husband?
I think I have. He is my number one supporter. I love Josh. He's great. He has always been there through it all and still pushes me every day to keep going. Yeah. Yeah. I love seeing him on our last marathon here in Las Vegas. I mean, just him following me, being the great spectator he is. Yeah. He's just very caring and loving. Thank you.
Is there anything you want to ask me or questions that you have for me? I'll put you on the spot.
I know.
No worries, but can I just say, let's kick ass.
Yes.
So, Laura, thank you so much for being here today and being a part of this podcast. As you know, this is something that Dr. Seth and I started really to talk about a different type of healthcare delivery system.
Yeah.
So I really appreciate your story, and obviously we don't interview a lot of patients to hear their perspectives, but certainly I believe that there are a lot of doctors that hear it and can sometimes be powerless to change, but I also think we should always be reminded that we went into this profession to serve people, and we should never lose that human connection that we have. So thank you for your story.
Thank you for having me.
So for these stories and more, go to www.outofnetworkpod.com or wherever you get your favorite podcasts, and I hope we're one of them. So thank you for watching.